Hello, everybody. Xavier here with the BarbaraCares Foundation. I am excited for another opportunity to present Roundtable. This is real, candid, life conversations that we present here at the BarbaraCares Foundation. And for those that are unaware of who we are and what we are a local nonprofit that provides social supportive services to breast cancer patients, caregivers, while also expanding the access of mammography screenings for those at risk, uninsured, and without the financial capacity to afford screenings. Again, my name is Xavier Sanders. I am joined with some phenomenal panelists today. And as we commemorate Black History Month, we felt that it was important for us to just shed some experiences of African Americans, people of color that go through a breast cancer diagnosis. I am joined today with Dr. Moss Lanier. I am also joined with Dr. Robin Screen, and we are looking forward to kicking off this discussion of lived experiences of African American breast cancer survivors. And so, without further ado, I do want to just do a brief introduction of our researcher today, Dr. Kim Moss Lanier, and I'm going to read her bio. Dr. Kim Moss Lanier has worked in higher education for over 10 years. Kim worked for the University of North Texas UNT Health Science Center at Fort Worth as an associate director for Texas Prevention Institute and served as a principal investigator and program director for Dallas Cancer Disparities Community Coalition Breast Cancer Prevention Program, as well as multiple grants funded by National Institute of Minority Health and Health Disparity Center for Disease Control, National Center let me scroll down a little bit there. National Center for the Institute of Texas, the Department of Health and Human Services and Cancer Prevention Research Institute of Texas. Kim currently serves on several community collaboratives across, including a board of directors for the Susan G. Komen Fort Worth affiliate. Kim received her undergraduate degree from Jackson State University in Jackson, Mississippi, her master's in public administration from the University of Oklahoma in Norman, Oklahoma, and her PhD from Texas Women's University. And without further ado, I'm going to yield the floor to Dr. Kim Moss Lanier. But before I get into that, I did just kind of want to talk about some statistics. Again, we are in Black History Month. And one of the things that is alarming for us here, especially in the state of Texas, we are currently ranked third highest in the nation when it comes to late stage diagnosis and mortality rates. And when you look at that, especially within communities of color, breast cancer has the highest mortality rate of any cancer in women between the ages of 20 and 59. And African American women have a 31% breast cancer mortality rate. And that's the highest of any US racial or ethnicity group. And so it is our focus here at the foundation to not only provide supportive services for those that are going through the journey, but to be able to have those honest conversations about disparities that exist and what we can do on a local and a state level to be able to address these. And so, Dr. Kim Moss Lanier, what led you to this particular topic, especially concerning survivorship?
Hi, Xavier. Thank you for having me today. I really appreciate this opportunity. What drove me to this topic academically and professionally was the limited information around African American women and specifically survivorship and their perceptions of the disease and the impact that breast cancer has on African American women. Personally, I chose the topic based on research findings that often minority women in the United States decline early detection screenings, breast cancer, cervical, and colorectal cancer screenings. And also that there is a lack of mistrust often, even with chronic disease treatments such as diabetes and hypertension, just overall medical mistrust. So I wanted to put a voice for women, African American women, for breast cancer survivorship, as well as personally, when I was in my early 30s, found a lump. It was benign, but it was my first introduction to what could have been a potential risk, what was a risk and could have been potentially worse for me. And my physician let me know that. So at that point, I wanted to be a voice for women who may not know or have resources and encourage prevention and early detection for breast cancer.
I love that. And I thank you for the work that you are doing to bring a voice to this. Oftentimes, there, especially for communities of color, there is that mistrust as it relates to the medical institution. And so I thank you for giving a voice for those that are going through this diagnosis, so that we can have discussion and dialogue, so that we can be in a better position for our health and for our wellness. Because, and I say this all the time, our health, it matters. You have to, one of our health fairs that we put on is our Care to Fight Health and Wellness Fair. And we put this on every October. And the reason why we say Care to Fight is because we want the community to really care for their health and to fight for their health. And so I thank you for, again, bringing a voice to the African American community, and for just breast cancer and other comorbidities that exist as well. And so I just wanted to just kind of do a deeper dive as it relates to the subject areas of your research and what exactly that entailed.
Absolutely. So there were 3 or 4 themes that were generated from the research. Um, the first theme dealt with physical and emotional scars based on breast cancer treatment, the role of faith in the healing process, village of supporters, and the system was not centered around the needs of Black women. Those were the 4 things that were generated and came out as a result of the findings from my research.
And if you are able to elaborate just upon those lived experiences, was there any big takeaway that you took away as a researcher that opened up your eyes to something that you may not have thought was a concern for those after they go through a breast cancer diagnosis?
Absolutely. So with this qualitative study, I interviewed 16 African American females, all between the age of 35 and 75. We also looked at survivorship between the very early stages to the more what they call permanent survivorship. So a woman who has been in survivorship, say 5 to 10 years. And in that, what we found in the things, for example, with the physical and emotional scars of breast cancer, 38% of those of the women that participated in the study opted for a mastectomy. 38% opted for a double mastectomy, and only 25% opted for a lumpectomy. So really, and when they talked about their reasoning for getting a double mastectomy, it really had to deal with their peace of mind. One of the quotes that came from one of the participants was that, she said, I know that by having a double mastectomy, I could still, there's still a chance that my breast cancer may come back, but I wanted to do everything I could to prevent that and to have peace of mind. So those were just that's just one of the quotes that came from that first theme, and how the women were seeking, that peace of mind of knowing that they had done all they could do for themselves as well as their families.
Did you find that while that you were conducting your research that the participants felt a sense of empowerment after going through a breast cancer diagnosis? And I prefaced that question with my mother, as she was going through her diagnosis. There were often times when she felt that there was a lot that she could not do, that power was essentially taken from her as she was trying to navigate the chemo, the new routine, her new normal of life. And so do you find that those that have gone through a breast cancer diagnosis, that they feel a sense of freedom and empowerment, knowing that they have essentially gone through a major traumatic event in their life?
Absolutely. I mean, one of the foundational theories that I used was Kleiman's explanatory model of illness and critical, and I also looked at critical race theory to look at the medical mistrust. But within the Kleiman's medical, the explanatory model, one of the things that it does is allows the researcher to explore just what you talked about, those different perceptions and the timing of diagnosis. the individual insight and the impact of and the effect of breast cancer, and the personal impacts and the treatments and the options that the women made. And all of that kind of fused together to help give medical providers kind of that cultural aspect, and to get as a way to get to know their patients a little bit better besides the medical piece. So you were talking about that empowerment. A lot of the women started out, they talk about how their diagnosis transformed them. They talked about how initially there was that onset of fear, but then there was a sense of empowerment. And as they went through and completed treatment, and some of my participants were still actively in treatment, but those who had completed treatment talked about how they had a different perspective on life. Having come close to dying, their perceptions of life were different. And so they were quicker to say no. Whereas women, women tend to take on a lot of responsibilities and duties, but they had set boundaries for themselves, those healthy boundaries that allowed them to participate and be active in their life, and as well as sort of stop and smell the roses and understand the value of what they have been through.
I love that. Dr. Screen, I wanted to ask you, as a medical professional, is it, and I know this question might seem a little redundant, but I wanted to ask you, is it ever okay to let your guard down? Even as I'm speaking with Dr. Kim Moss-Lanier in the subject of survivorship, is it ever okay for someone that has gone through a breast cancer diagnosis to let their guard down?
There is a compound answer to that, and the answer is yes and no. I think when we talk about living our daily lives, living our lives to the fullest, doing the things we've always wanted to do, achieving those goals, it's okay to let your guard down. I think as far as follow-up, maintaining your health, doing things to reduce your risk of recurrence, in that sense, you can never let your guard down. And the reality of all of this, and I learned it first from my aunt, who was initially diagnosed with breast cancer at 38, is that once you have that diagnosis, it never leaves you. That fear never leaves you. That when is it going to come back never leaves you. Now it gets quieter, but it never leaves you. And so you have to do your due diligence in two ways. One, to keep up with your follow-up appointments, your mammograms, all of those types of things, and to take care of yourself and keep up with your health. And then, to indulge that self-care, so to speak, and, become the person you've always wanted to be. Because I think, as Dr. Moss-Lanier said, it's life-changing. And so what are you going to do about it? Because, I, at least, especially from talking to my aunt, you're being given a second chance.
Right, no, absolutely. And I guess if I could ask a follow-up question for Dr. Moss-Lanier, in your research with the participants, was it ever brought up of what are next steps? What exactly does survivorship entail? Yes, I've rung the bell. Yes, I don't have to go through any more treatments, or there might be some modified medication that you have to do to mitigate any recurrence. But what did your participants discuss with you as relates to what survivorship looks like for them? Because for me, I've never gone through a breast cancer diagnosis, and so when I look at the term survivorship, the first thing that comes to my mind is that you've turned the page to a chapter that you have essentially survived and made it through. But what are the next steps that your participants talked about, either in maintaining their health and wellness, or either forgetting this altogether, that this chapter of their life happened?
That's a great question. And I will say, somewhat of similar to what Dr. Screen shared, it's a little bit of a complex response, because one of the things that came out of the emotional and physical scars of breast cancer was that that diagnosis is a lot like PTSD, similar to what Dr. Screen said. A lot of the women shared that you never really get over it. You learn to live with it, but there are triggers throughout your life. Some of those triggers can be family members who are diagnosed afterwards. Some of the triggers can be small triggers. How they found out they had breast cancer could be a trigger. And so several of the participants had sought counseling to do just what you're talking about, and that was explore survivorship. I recall one of the survivors saying to me, her name was Daphne, she was in her 30s when she was diagnosed. She really started out her diagnosis somewhat in a cloak of secrecy, which is a lot of sometimes what happens in our African American communities. Her mom, she told her mom, and her mom's initial reaction was, "Don't tell anyone. Let's just keep it between us." And so that made it a little bit challenging for her to work through her initial diagnosis, because she felt like she was conflicted between wanting to share and talk to her friends and then only really being able to confide in perhaps her mother or her husband. As she went on through her treatment, she did open up to her friends. And what she found is that after she did that, she actually started to heal and started to, kind of come out of that surviving and start living, as she called it. So that's what they talk about, is evolving from survivorship and becoming someone who is living and enjoying life. There are other women in the study who talked about, while they are living and enjoying life, they've since retired based on their health conditions. I had a couple of women who had reoccurring diagnoses, and each time they had chemotherapy, and the toll that it taken on them, they now have different comorbidities. And as a result, they have since stepped out of their professional world to enjoy life more and to live life to the fullest. So it just varies per, where a woman is in their life, how, what their support system is like, and what their outlook and how their treatment impacted them.
And I am so happy that you mentioned the aspect of the importance of getting either counseling or being able to have an avenue to be able to express your experiences that you're going through. If it's one thing that I really kind of beat myself up about, and it's no shame, I tell everyone this all the time as I do self-reflective of my mother's journey and us as a caregiver. One of the things, because I'm a mama's boy and my mom was my best friend, I wanted to protect her. And so when she went through her breast cancer diagnosis, I was the same way. Mom, no, not telling nobody, we're going to pray this thing out. We're going to stand strong as a unit. Let's not provide access to everybody into this space, this life-changing event right now. But I saw how restricting my mother from expressing her feelings about it, that put her sometimes in a place to where she was not always the happiest, because she wanted to just say, Xavier, I'm feeling like this. And for me, everybody that know me know I'm typically a ray of sunshine, always trying to look at everything from an optimistic perspective. But for my mother, some days were not good days. And so allowing someone the opportunity and the space, the ability to be able to express themselves, however that might be, it's important. And so for individuals that are walking that journey with the survivor, or for those that are walking the journey with someone in active treatment, based upon your research, would you say that it's safe to say allow them that room to express themselves however they feel, so that they can have the freedom and the flexibility to enjoy survivorship or even the journey as well?
Yeah, that's very intuitive, and just that experience that you share, that is so true. Absolutely. One of the things that came out that I mentioned earlier was the role of faith in healing.
Yes.
And so of the participants all talked about their relationship with God and how that was a huge part of their healing process. They also mentioned their village of survivors, those key people who, like Dr. Screen talked about her aunt, they had people in their lives, in their family as well as outside, that allowed them that room to heal. Part of that is them also allowing others who are wanting to help them to heal along with them. The women realized that while it was happening to them, it was also happening to their mothers, their fathers, their husbands, and their children.
Right.
And so how could they share in that journey and not alienate them? That's where they really relied on their faith. They also talked about how small gestures, gift cards, prayers, prayer groups, books, help them along their journey. So I think it really is about understanding the boundaries, especially in the beginning of a diagnosis of cancer. What are those boundaries? And honoring those boundaries, even if they may seem or appear restrictive on the outside, understanding when there's a need for a cry for help, and when you should seek counseling, and always leaning on those healthcare providers and health professionals to provide that additional insight on not just the treatment of the physical body, but the mental body as well.
Absolutely. If you don't mind me asking this question, just as it relates to the survivorship, did you notice that there was a particular trend for those that, as relates to when they were diagnosed, were these late stage diagnoses by chance, or were these just across the spectrum of different diagnoses? I was just curious to know, just based upon the participants, were these survivors, were they diagnosed at a pretty early stage, or if they had late stages?
That is a good question. So I was fortunate enough where the study was very robust. So I interviewed a 70-year-old woman whose mother had breast cancer, and she got diagnosed in her early 70s. She actually felt the lump and knew it was growing. She did not go to the doctor. She chose not to go to the doctor. She was afraid. There was that fear that we sometimes have. And she prayed up until she realized that she needed to take action. She then confided in a friend. That friend got her help. She later on confided in her daughter and her family. When she found out, she was close to stage 4 triple negative breast cancer. So she was able to have a full recovery, go through surgery, chemo, all those things. But she really waited to the very last minute, like I said, because of that fear. On the other side of it, I have one of my participants found out at stage 0. She was very fortunate. She had been participating in annual mammograms. It was right before the holidays. She always, kind of on a system of getting it done around the holidays. Her physician told her it was early. She did not have to do chemo. She did do a lumpectomy, and is taking oral drugs for another 5 years. But that's just the kind of the spectrum of breast cancer. You have those women who are, kind of very true to their prevention health. And then you have those women who know or don't know and may have never had a mammogram. The 70-year-old that I talked about, she had never had a mammogram, even though her mother had breast cancer. So that's why for me, I can't, I say it's breast cancer 365, because we have to be able to discuss it and have the conversation around cancer every day, because there's someone out there who may be curious, may even have family, but have not taken action to actually get prevention services.
Right. And I wanted to bring Dr. Screen in with just that last piece. For those that are not familiar with the BarbaraCares Foundation, we actually have a Mammograms Matter health initiative that we do. And it's where we are focused explicitly and as detailed as we can to provide access to mammography screenings across hard-hit areas here in the Metroplex. And Dr. Screen, I just wanted to ask you if you could speak to the importance of those screenings and the type of mammograms that are available for women, and when and why they should be active in making sure that they get those wellness checks.
Okay, so let's start with when do we begin screening? Because that seems to go back and forth and be up and down. I follow the guidelines of the American Society of Breast Surgeons. Breast health exams should begin for a woman at about age 20. Um, and you can either these days find the correct information online on how to do a breast health exam, or when you visit your doctor, ask, they'll explain it to you. Also, then at age 30, you want to begin clinical breast exams. So that's annually with your family doctor or your gynecologist. And then baseline mammograms, the recommendations go back and forth. But as I said, I go with what the American Society of Breast Surgeons says. And they state that every woman should have a baseline mammogram at age 40 and every year thereafter. In African-American women, our disease is a little bit different. I know at one point there was a push to begin screening African-American women at age 35. But you always have to weigh the risk and benefits.
Right.
So the current guidelines are at age 40, unless you have a family history. If you have a family history, then those mammograms need to begin 10 years before that relative was diagnosed. So if your mom had breast cancer, was diagnosed at 35, then you need to begin doing mammograms at age 25. That was the case for my cousin. We had an aunt who was diagnosed at 38. And so she started mammograms due to her gynecologist getting involved, because she lives on the other side of the country. But her gynecologist made that recommendation. And at 32, she ended up being diagnosed with bilateral, both breast cancer in both breasts. The blessing in all of that, though, was very early. It was stage 0.
Wow.
If she had waited till she was 40, it could have been a different story. I think that if you live in a major metropolitan area, it's usually easy to find a breast center that is certified by the American College of Radiology, which means that they meet the standards and they know what they're doing. You want to seek that out. Most institutions or facilities now are using what's called 3D mammogram, and that's basically like a CAT scan of the breast. You won't notice a difference when you go in for your mammogram, but it does give you better pictures and is better at not only picking up more cancer, it's better at what we call those callbacks. They see something and then they have to call you back to do more filming. And with the 3D mammogram, they're able to tell better, oh, that's not cancer, it's nothing to worry about.
Thank you so much for the breakdown of that. Again, as we are celebrating Black History Month, I just wanted to just bring perspective of why mammograms are important, when you need to get screened, so that if for some reason you are diagnosed, it's always been said that early detection is key. And so I thank you, Dr. Screen, for shedding some light of when those screenings are important, and then the differences between those particular screenings as well. Dr. Kim, I wanted to just end this segment with just a final question for you. What was your biggest takeaway from this research, and what would you like agencies like BarbaraCares to do to further support survivors based upon the results that you got from your research? And also a question as it relates to what we can do to better prepare individuals that are potentially at risk and those that are hesitant to go and get screened. And so I know those are a lot of questions, but essentially we just want to know what was your biggest takeaway and how we as organizations can support research that you found during your studies.
Well, my biggest takeaway, I think, was that the importance for healthcare organizations to really look within themselves to do cultural assessments, to provide physicians and other caregivers with information around minority health and particularly African women breast health, so that that women feel encouraged and welcome to come in and get these prevention services, and not just African American women, but all women. So that even though rates, there's been a decline over the years in terms of death, there's still, that increase in the steady measures around African American women and dying from breast cancer. So there's still a need there organizationally for healthcare organizations to do that. future research, I think what we can do as public health officials is we can explore the role of health educators and how they might be able to bring about social change with breast cancer prevention and other prevention services. Often you'll hear health educators called lay health educators or promotoras or community health workers. They help bring some familiarity once trained in a particular area or public health research. They can be, evidence-based research is found where they can be very influential in community-based research practices to help bring about those social behavior changes. Also, include a more deliberate exploration of African American breast cancer survivors around mental health and post-traumatic stress. While there is information in the literature that talks about breast cancer survivorship and breast cancer and in some of the post-traumatic stress, there is a gap. And I think that's something that organizations can do to help and explore for those survivors.
Right.
Also include information around maternal breast health and that family history that Dr. Screen talked about. A lot of women don't know their family history. They tend to explore it maybe after a diagnosis, but any public health research or public health programs that can influence family history and understanding your family history is also a good opportunity to help women overcome breast cancer and encourage prevention services.
I love all of that. Those are some great takeaways, and definitely going to be partnering with you to see how we as BarbaraCares can do more on not just a local level, but also on a state level as well, to be able to incorporate those. It matters. For people to be able to, and not just African Americans, but women in general, and also men. Men are also at risk, although the numbers are not as high, but men are also at risk for breast cancer. And so being able to do everything we can to shed light, provide education, resources, materials, we're all for it. And so I thank you, Dr. Kim Moss-Lanier, for taking some time out today. I thank you, Dr. Screen, for also taking time out today. I am just completely just overjoyed with the fact of you shedding light on a conversation that needs to be had. And one thing that really makes my heart excited, I was at a meeting the other day, and you just never know a person's story. And in my brief introductions, the lady mentioned that she was a survivor. And so it always makes my heart happy to know that there are survivors. A lot of times when you say cancer diagnosis, you think of just the unfortunate end, but there are survivors. And so I thank you for shedding light on this topic of lived experiences of survivors. And I want to end it with this. If anyone is in need of a mammogram, if anyone needs supportive services, counseling, healthy meals, financial services, we are here for you here at the BarbaraCares Foundation. Please feel free to check out our website at www.barbaracaresforyou.org. And we count it a blessing, we count it an honor to do our part to help support and provide resources for those that are at risk, uninsured, and just in need. And so I'm going to end it with this, in the words of my mother. Everyone, I want to encourage you to continue to fight, continue to smile, and continue to fight some more. This is Xavier with the BarbaraCares Foundation. Again, I thank you, Dr. Kim Moss-Lanier and Dr. Robin Screen, for another roundtable, real, candid life conversations. Until we talk again, stay safe and be well.